things have a way of deteriorating really quickly when it comes to abuse, whether interactions with other adults, whether it be interactions with other who have difficulties trusting, difficulties with family members, difficulties. And one of the things is when you get out of this environment and we go into placement and we have adult issues, especially disabilities associated with childhood trauma, blackouts, nightmares, night terrors, the severity, they usually have a scale for the severity of the abuse. And typically when we talk to therapists and doctors about group and why it is that certain family members have to write letters and why certain family members have issues is generally because a lot of family members have separate issues. Their cases are separate. Sometimes a parent having issues with other children, it's not all bad and it's not all good. It's just they have to be supervised on a continual basis because in the past, and it's been the pattern with relatives and family, they abandon us, they leave us stranded. And what happened was over the course of the last year, we gradually deteriorated. And that is obvious. That's why once we come back from the hospital and get into medical care, especially the severity of the neglect, the severity of the abuse issues that come out, we cannot be home alone for too long. I know this one thing with kids that have been left abandoned, they cannot, because of the severity of the abuse, they are in a different placement. Adult foster care is oftentimes the only option. They cannot let their family members go back home. And because of past issues, because of past trauma, the only way to get the right kind of help is a lot of times with children who have severe neglect issues or abandonment issues, they have to either be placed in not just from foster care, but into adult foster care because of the severity of their case. Oftentimes kids think it's okay, things are back to normal, and that's not the case. It's been consistent with the abuse in the past. They have to meet with their family members or they have to meet with a therapist and they have to be on observation. Because of the severity of the trauma and blackouts, we've had severe medical problems, including blood pressure issues, a whole wide range of issues. Now dealing with children, like in the case with Bentley Miller, there could have been more intervention done. They need to intervene. When you see that there's a pattern of drug abuse going on and the severity of the neglect and the severity, when they go on a home visit, when those who work with children, they have to make sure they contact the police when they go and meet with the parents. They have to meet with certain family members. They cannot have, when a parental rights issues show up, it's because of severity of drug abuse or other problems. When there's children and parents and families that have difficulties, usually you can tell by the interactions with the parents if they're a loving relationship, kind, that they proper correction and discipline. Otherwise, what ends up happening is the kids start acting out, they start becoming isolated, they start becoming kind of like introverted. You can tell by the parents' interactions with the children that they have an overall healthy relationship. That's generally what's been going on with a lot of family members. A lot of family members will sit there and say, well, you did this. It's not about that. They have to be careful who they interact with. That's not because they're the problem. It's because there are other people around who either abuse certain members of the family or abused other members of the family. And there's individuals, especially, who look the other way, especially when there's cousins and relatives or anyone who are hanging out. They cannot be on a visit unless they contact the therapist, and they have to do an intake. That is generally how it works. We have not been able to attend our therapy appointments. We've not been able to attend doctor's appointments. We have not been able to get anywhere. We've been in a threatening environment too long. They have to go meet with a therapist. They got to go meet with their friends or go to work or do their thing right now. If there's any issues, they have to have either somebody observing the kids, and YMCA is a good option. As far as daycare needs and safety issues, these issues will come up day to day. These are daily issues that will come up, especially when we've had night terrors and bathroom problems to begin with. There's always something going on that has to be observed by a therapist and a caseworker. In order for the caseworker to do the job that the caseworker needs to do, they have to be in therapy at least 6 months in order to get the kids back into some kind of normal routine, especially after we miss work in school, gas problem. I mean, every problem we are dealing with right now is because of abuse trauma, childhood abuse trauma. It is the reason we're having problems. It's the reason we have problems getting dishes done. It's the reason they pass out. We have several problems, especially in the courthouse, especially when we go to court. There's all kinds of things coming up day after day. The best way to supervise some of it is with a therapist that can help us. And prayer. And there's a lot of safe places to go. They have to stay in a group. They have to talk. When we go on an outing or anything, we have to make sure there's gas in the car. We got to make sure we have enough money to get where we need to go and get back home. We have to have an on-call person who can fill in. That's the staff issues. So there are things as a school administrators can do to help, like making sure that if there is a problem that the kids can't get home, that they immediately report to like the principal's office and address the students. If there's issues at home, they have to meet in the cafeteria or meet somewhere. A lot of times when kids have problems at home, especially in junior high, they should already know this, but you have to repeatedly explain to kids, whether it be in an assembly or at school, if you're having problems at home, meet in the gymnasium or meet at the cafeteria and have a school therapist evaluate what's going on, including a guidance counselor and some other issues, because this is going to be a consistent problem. And acting out, making sexual comments, all these behavior issues are showing up and are going to start surfacing more and more. This whole thing with acting out, not being able to get to a bathroom, the dirty issues, the pornography issues are going to come up. These things are going to come up and they're going to be addressed accordingly. They got to talk to the school therapist. If they're not comfortable, talk to a school cafeteria, talk to the school security. It's really that easy. If you're having problems, make sure you go to the gymnasium, and maybe somehow there will be other teachers that can help out, because we have student issues. We have issues, especially isolating. If they're isolating too long, that's why they have to be supervised, because there's been abuse issues coming up. Especially a lot of times children, whether they were abused or not, they might have issues with what happened to their parents when they were children. A lot of times these children are acting out because something happened to their mom when they were little. A lot of times children act out and they understand their parents a lot better than you think. A lot of times children, the way they're raised to be kind of protective of their parents. So there's a lot of things going on. Generally speaking, though, if kids have problems, if they're having problems at school, if they're having ever problem, go to the cafeteria, talk to the cafeteria lady, talk to a manager. If a manager doesn't help, then talk to somebody that will. There are people that are willing to listen. There are people who are willing to help and be supportive. As far as going to support group, that is general. I almost wish we were at support group. Whether we have support group at home, whether we have support group at school, there needs to be some things addressed at a school assembly. When it comes to childhood neglect and abuse, it's everywhere. There is levels to how much poverty. There is levels to abuse and neglect. I mean, when I start seeing neglect issues, initially my first thought is they got to get to the doctor and get to the emergency room. Start there and address what's going on with the doctor. These are absolutely difficult issues that are hard to comprehend, especially children who need to be supervised and observed regularly. They need the proper structure. They need a proper, consistent relationship with their with the adults. The child-parent relationship, same thing. If there are interactions that just seem not so, I mean, it might not be anything that the parent did. Maybe there's some things going on in the parent's life. Maybe there's something going on in the children's life. It's better to intervene and have a crisis intervention team evaluate it. That's really where I think, as an end-all, be-all, when they are placed in some kind of program, where it's like play therapy is one of the examples that we're sharing with you, that a lot of times a therapist can identify the issues and have a well-rounded discussion. Listen, I can understand why parents felt threatened. I can understand it, but when their kids start acting out and having behavior issues, it's better to get ahead of it than let something that happened to Bentley Miller occur. This is a reoccurring problem, especially when there are a lot of people that look the other way. They're not either paying attention or not making phone calls, or maybe there's some things going on at home. We need people to, engage at a teamwork as a team and as individuals. We have to be on the same page. It's vital. It's life and death for some of these children. Okay, so attending a conference or going to a parent-teachers conference, attending conferences at Children's Hospital, this is right up their alley. They have to know how to behave around their children. If they don't have a good relationship, it'll be up to the doctors and the therapists to decide what happens from this point. Thank you for listening to this blog post. Please continue to pray and support us here at #KidsUpForKids. Also, some other things that we're doing. Please know we have been through a lot recently, so I just hope and pray that some of us can get the right kind of help. It's been very difficult. It has been troubling, and a lot of things that we go through, especially with laundry and food and just getting around overall, has been obviously difficult. So please know, keep us in your prayers. We have a lot on our plate right now, so we got to take it down a few notches and just chill out for the rest of the day. Thank you for listening to this blog post. If you would like to support us and continue to support what we're doing in our art and therapy work, and also work that we continue to do in education and arts and humanities, please contact us at the information below. Thank you. some of the things we have worked with doctors and psychiatrists especially, that certain individuals cannot and they don't interact with certain individuals because of personal struggles, difficulties. A lot of times it's just being able to adapt in a better environment. Um, Everything from, personal hygiene to coping skills, things that really are going to be addressed in counseling and group. And there are certain reasons why certain patients and clients can't work with other clients, and it's because when they're placed in a group and when we're placed in, definitely in recovery group especially, because not everyone has the same concerns, not everybody identifies it with the same concerns. Working with first responders, working with detectives, they go through this interview process on a regular basis because of these type of issues. And we definitely talk to department heads and we've talked to therapists, and one of the problems is being able to report it properly, and there's been a reporting process lack of response sometimes from the victims and families themselves because of medical issues and trauma issues, that it does require crisis intervention. Crisis intervention, what it does is it allows a team to go in and assess the patient, and typically they'll be able to know exactly what they need to do when they get to the emergency room or to whatever medical treatment center they need to go to. Initially, in home-based therapy, what we've learned about basically is that if we don't have a way to contact a therapist or doctor, there's other supportive groups now online. Peer support specialists, especially if you go into these programs. ACEs has a program here locally, and there's other support. There's other support groups that initially they have to go through the initial intake. A lot of times, if the clients and patients can't get to the appointments, they have to have an on-call person to assist. That's been typically how it works. I mean, it's a lot easier to have at least an on-call person, staff, or security to be able to do wellness checks and check in with the clients, because overall, when especially when police officers do patrols, they'll know which households have been having the difficulty. It's the ones that don't report it. That's why we want to share with you about the warning signs and signals of neglect and abuse. You can tell basically a general healthier interaction when certain individuals are not in the room. You can also tell how they respond and behave. Body language is a good one. It's a good indicator on what's going on with certain individuals, whether it be garbage issues, toiletries, overall just personal hygiene. Those are things that you can look for. Also laundry. Hygiene is the biggest, especially if you're around abuse long enough. Definitely with a patient, there's going to be several things we're going to hit on, especially bedside manner, etiquette, manners, how we interact in public, how all types of things will show. Here's the thing, overall, we're not that difficult. What we're trying to share with you guys is that we've had several issues with threatening behavior overall, that there are certain individuals will not be allowed to be in group or at home-based therapy for initially because of abuse issues, especially certain individuals with drug abuse issues, because we don't have the same issues at home. We don't have drug issues. We don't have. It's really the isolating. It's the withdrawing. It's the crying spells, the bathroom problems, the physical pain. We have to get up and get things going. And one of the things right now we're going through is laundry. We have issues with certain individuals with laundry. We have several issues going on. I think pretty much I can hit on every issue, especially with the acting out, sexual abuse issues, rape issues. There's going to be several things we hit on in therapy and group, and it will be handled directly by the individuals that need to be handled by. Overall, when it comes to neglect and abuse, there are several things that will show up, like definitely like skin rashes, things like that, eczema. Initially, when they're in placement and dealing with a certain level of sexual abuse issues, it'll be up to the doctors and it'll be up to the family members to address those issues accordingly. Overall, though, as a wrap-up, I really hope that if you guys have problems, if anyone has, please contact somebody. Don't let the problem get to the point it's so out of hand that nobody can get the the help they need. Because here's the problem: kids get lost easily, things go wrong, and all you have to do is not look the other way. And there are all kinds of issues that'll come up in counseling. We deal with doctors. We've had a very good relationship with our doctors. We've had a very positive outlook overall. Art therapy, dance movement therapy, these are things that really are beneficial to physical health as well. So, and prayer support, just a numerous things going on. We can hit on almost every topic, believe me. The idea is to get into a healthy routine, whether it be at school. If you're at school and you're not feeling safe, it's good to talk to the school counselor. I mean, there are ways to talk to someone, whether it be at school, whether it be at a support group, whether it be on campus, off campus, security issues. A lot of times, if kids are having issues driving back and forth to school with a parent, if a parent has issues with a student, talk to the school administrators. There's ways to intervene. Instead of allowing abuse to continue, having somebody to support, especially support group, because if you're in support group over long periods of time, believe me, it'll be a lot easier to manage some of these issues. And that support group is a lifesaver for a lot of kids. It's the ability to walk away. It's the ability to say no and be okay with yourself and not be blaming yourself or angry or acting out, because a lot of times this whole neglect and leaving somebody out in the street or issues that show up, there are going to be several issues that we're going to discuss in counseling, and they can exit the program at any time. And right now, as we exit this program, a lot of the family members that they're dealing with are going to have to deal with therapy and therapists from here, because really that's how we contact family if need be. Overall, on observation, I would not normally be isolated, but there's several issues personally with disabilities at home, and overall, we need to make sure we have someone to contact when we're not feeling good. Okay, so know this. I hope and pray that whatever help we get from here, that we get the proper support system, and we get. Obviously, we've had safety issues, especially childhood alcoholism or alcohol drug use. Those are things that are initially going to be addressed. And getting into therapy and counseling initially is important. So if they want to continue a relationship, they have to be able to contact the therapist first before we set up any appointments and interviews from here. Thank